In our study, we studied from the most immature B cells, which are the precursor B cells, to the plasma cells. And we observed that there were many markers deregulated, in some cases more than 1,000 markers. And since we are studying those which are CD coding in order to implement them in flow cytometry panels, we believe that this could be a very like a huge benefit for patients, since these potential biomarkers could allow us to identify which patients are at higher risk of relapse, and also because these spectral flow cytometry panels are being developed to study the presence of MRD and CTCs not only in the bone marrow, but also in the peripheral blood, which is a minimally invasive way to assess the presence of tumor cells.